Good morning, everybody. Thank you for joining us again today here for another Rural Health Transformation Program office hours session. My name is Betsy Wood, and I'm the Director of the Office of Health Savings with the Alaska Department of Health. Today, I am joined by a number of members from our Department of Health team, as well as folks from the Alaska Community Foundation. I see we have a number of folks who are still joining. People are kind of coming in, spend their lunch hour with us talking about rural health transformation programs. So I will give you a quick reminder that it's really helpful for us if you can use that Q&A feature. I think if you don't see it at the bottom of your screen, if you press the circle with the three dots inside of it that says more, there's a Q&A option. And if you can start putting your questions into that Q&A space, that helps us get a sense of what questions people still have, helps us answer them live on the call. I know we've been trying to answer as many questions as we can throughout these office hours and in our emails and all of that, but I think it's really helpful for you guys to start to use that function, and we can begin to answer the questions as they come in. Just as a reminder, we are trying to put out as much information as we can, as we have it. Our information shifts over time, so we do really appreciate you re-engaging with us as we hold these office hours each week, so you can have kind of the most up-to-date information and get your questions answered around how to use the letter of interest process and how to engage with the department as we go forward. Today, we're going to provide a brief reorientation to where we are, kind of a reminder of what the letter of interest and registration stage is. We're also going to share information about some new resources that we've put out. We've been updating our website with more information that we hope will be helpful to you. And we will, of course, leave plenty of time to answer your questions at the end of this call. So as a reminder, the letter of interest and registration period opened last week on February 17th. And this first round will remain open through March 11th. So that means we're currently in that kind of registration letter of interest process. This is the first step for organizations that are interested in participating in this round of Rural Health Transformation Program funding. It's meant to be an early way for you to indicate to the department that you are interested in engaging in this process, you're interested in applying, and to give us a sense of what the project or projects are that you would like to propose. I would like to remind everybody this isn't going to be the only letter of interest opportunity. We are going to open up funding opportunities and offer this process multiple times over the life of the Rural Health Transformation Program. So that's really important for you to be thinking about as you start to build out your portfolio of projects that you're going to propose to the department, especially in this first year. I think those of you who've been with us before have heard us talk about the timeline for this first year, this first budget period of the Rural Health Program. And really, you want to be thinking about what is your organization prepared to, and what do you have the capacity to kind of execute on and achieve within this first time period. So again, that's our very first budget period runs through the end of October of this year. And then we have through the end of September of next year of 2027 to finish up spending the funds from this first time period, this first budget period. So especially in this first round, we are so excited to see everyone engaging, but we also want you to be thinking about what does my organization have the capacity to do right now, and where are some areas where maybe you want to continue to build and think about future funding opportunities as you need it. So I mentioned that we've been putting some new resources on our website, and I think one of my friends can put the link in the chat to the Department of Health's Rural Health Transformation Program website. But one of the areas that I really wanted to call out for folks is a section of the website called Funding Opportunities and Applicant Information Center. It's near the top of the page, and this is where we are trying to consolidate information that would be helpful for applicants as you move through the process. So there you'll see a link to the letter of interest portal that is hosted on the Alaska Community Foundation's website. You'll see quick links to our statewide rural health transformation application and proposed initiatives. These are pieces that are really important for you to be familiar with as you move through this process, because your project or your proposal, your requested funding really does need to align with those initiatives and needs to be able to articulate to us and to our federal partners how your project really advances those initiatives and is aligned to that. There's also a quick link to the frequently asked questions section of the website. I know that kind of gets pushed down to the bottom of the page, and this is a way for you to jump there quickly. And we've also developed an applicant resource guide. And this applicant resource guide is really our kind of stab at pulling together some of the critical pieces of information that will be helpful for you to be thinking about as you move into full project implementation. So we kind of have consolidated and pulled together from a number of different resources some of the information we want you to have in your hands, particularly around what are the allowable and unallowable uses of funds under the Rural Health Transformation Program. We try to provide some more information around some of the federal funding limitations. You may have heard us talk about how some of these allowable uses of funds have certain caps that are federal limits on how much of the overall award can go to any given type of funding use. We talk a little bit about, organizations that we see as eligible for participating in the program, information around sustainability, and just some kind of general compliance considerations. I think this applicant resource guide will evolve and grow as we move through the program and as we have more information, but we do think it's a helpful place to start if you're trying to kind of orient yourself or your organization to the entire program. The final piece that I want to mention before I pass it over to Megan with the Alaska Community Foundation is we've heard a lot of questions from people about the reporting requirements and what kind of reporting will people need to provide, what should they be prepared for. And I just want to share that, as we're growing our program and building this up, our partners at CMS are doing the same. And so we expect to hear a little bit more, maybe even as soon as this week, about the type of reporting, programmatic reporting that applicants will be expected to provide if they receive funding under the Rural Health Program. And as we get more information from our partners at CMS, we will share that out for Alaskans to be thinking about. We will link to it on our page. We'll provide as much information as we can, but I did just want to flag that we're expecting more information in the next week or two, and once we have that, we will share it out. So with that, Megan, I'll hand this over to you, and maybe you can reorient us all to the letter of interest portal and highlight any areas that you think are helpful for people to be aware of as we move through, and then we can dive into questions.
Sure. So thanks, Betsy. And for those of you who haven't seen any of these webinars, my name is Megan Cassiola. I'm the Vice President of Programs and Grants at the Alaska Community Foundation. I'm going to share, I had thought because the button existed that I had permission to share, but it turns out I don't. Okay, here we go. I'm going to start by sharing my screen with the actual Department of Health website to show the pieces that Betsy just went over. When you go to the Rural Health Transformation Program page at the Department of Health, you'll start by seeing the overview. There's the latest update, which has a register and submit LOI button, which takes you to our portal. And then there's also the Funding Opportunities and Applicant Information Center, which is the new section that Betsy was referring to. There's again the link to the letter of interest portal, the proposed initiatives, the FAQs, that quick jump that Betsy referenced, the resource guide coming soon, and more details about other aspects of this. This is where you're going to find a lot of information that are related to those questions we keep getting over and over again from applicants. And so when you click on the register and submit, you'll be taken to our portal. One of the things that I think is just important to note is I've gone through the creating account process, both in the pre-application or pre-LOI launch webinar, as well as the first webinar. If you need help with that, those would be the places to go. But once you are logged in, you're going to click to apply. One of the most common questions I get is, how do I actually submit multiple applications, multiple letters of interest? And the way that you do that is by clicking that apply button again, and then it'll notify you that your organization already has a request in progress, and you go ahead and click apply again. And that will open a new letter of interest for you to fill out. And so you should be familiar with this at this point. And this form that is available, I went through in great detail during the first session how to fill this out in all of the different sections. There is one major change that has happened since our last webinar, and that is we have heard your feedback about the UEI number and SAM.gov registration. And so that section is now optional. If there's now a question that asks you whether you have a UEI number, which is required, and then you can, if you do have a UEI number, submit your UEI. A few notes on this. The first is that you cannot receive a federal award without a SAM.gov registration in place. Our readiness and planning grants, the funding associated with that, does require that organizations have a UEI in place. And so if you submit a letter of interest at this stage without a UEI, you will not be receiving funding through this form, through this process. But this is giving us information about your desire to apply, and it helps us to assess the need for support so that we can look into what kinds of support we can provide. If you are in the process of getting a UEI number by registering for through SAM.gov for that number, I recommend that you keep your application in draft form until you receive your application, you receive your registration and your number so that you can enter it and hit submit. Or if it's the day that it's due and you still haven't received your UEI number, at that point, go ahead and submit without the UEI number. We have access to the drafts in progress, and so we will see that you have a letter of interest in progress without a UEI number, and that will help us to assess what the need is in that regard. So the funding is only available at this stage if you have a UEI number, but you are able to submit or just keep your application in draft mode, your letter of interest in draft mode, with that acknowledgement that you're still working on the SAM.gov registration at this point. So that's the major change, and it's because we just heard from a lot of people that they wanted to be able to move forward with the letter of interest without certainty that they would be able to get the UEI. And we are just trying to assess the total need for that UEI, the SAM.gov registration support. Okay, so the other question that has come up frequently with regards to this form is whether it is possible to add more people beyond the primary contact and the fiscal contact. And the answer is yes, you can add many contacts to your organization and to this letter of interest form. You can even have them as collaborators on this if you have multiple people that are contributing, editing, revising, answering questions. And so to do that, there is a collaborate button at the top of your form, and you will have the opportunity to invite someone to the letter of interest that you have already started. There are 3 options for that. You can add them as a viewer, as an editor, or as somebody who has the power both to edit and to submit the form. And so you can add as many collaborators as you want. And so if you want to have 5 people at your organization be part of the contact list for this project, add them as collaborators. If you don't want them to actually be able to mess with the form as you're filling it out, add them as a collaborator, but give them only view access. Okay. And so again, you are going to be filling this out. There are a lot of questions. They're largely drop downs and selection buttons. And when you get to the end of the form, you will have the option to save application. So if you have an application in progress, but you aren't ready to submit it, go ahead and save application. Again, if you don't have your UEI yet, it's in progress. You're waiting for the SAM.gov registration email to give you your UEI number. Then I would just save the application, keep it in draft until you have the number or until the end of the submission period, until March 11th. And once you're ready, you can submit the application. If for whatever reason, let's say you've got 2 people at your organization who've simultaneously started letters of interest forms for the same project, and you only want to move forward with one of them, you do have the option of abandoning one of the requests so that you just have one request in progress. And so that is also an option for you. Once you hit submit, though, the only way to bring your letter of interest back into draft mode so that you can edit it is to email us. You can email us at rhtp@alaskacf.org. And so if you have submitted your application and you need to make changes, email us. If you've submitted your letter of interest and you want to pull it back from consideration, email us and we can change the status to abandoned. But if it's in draft mode, then you have all 3 options. You can abandon it at any time. If for some reason you need to, you can keep it in draft mode for as long as you need to, or you can submit it. Okay, so I think that those are the primary new elements that I wanted to make sure everybody had the opportunity to see. But one thing that I'm just going to do as well is go back to the apply section up here. And again, show that if I wanted to start another letter of interest, I would just click this apply button again. There's a notification that there's an existing request, and I would click the apply again button anyway. There's nothing stopping you at this point. There are a lot of people who get this pop up and have the impression that this is suggesting they're not allowed to keep applying, submitting another letter of interest. And that's not true. You can move right past this by clicking that apply again. The other thing that might happen is if you've submitted a draft, then when you log in, you may see a different screen. Instead of seeing the list of opportunities, you're going to see the letter of interest you've already started so that you can keep working on it. You can click this continue, you can click on the title of it, and you may ask, how do I get from here to start a new letter of interest? And the way you do that is by either clicking the See Opportunities or the Apply button at the top of the screen. If you do click either of those, you'll come back to this page where you'll have the opportunity to click that Apply button again so that you can submit another LOI. So that was everything I wanted to walk through ahead of the Q&A, and I think that we can go ahead and move into that Q&A.
Okay, well, thank you, Megan, and thank you, Betsy. For those of you on the call, my name is Emily Ricci, and I am the Deputy Commissioner in the Department of Health. And I get to play radio host for the next, I don't know, 37 minutes. But we've seen a lot of questions come through. Some have been answered in the chat. Keep your questions coming. Megan, I just kind of want to start again with the LOIs because we got a lot of questions about LOIs, and I know people are joining this at different times. So just to recap, you can submit multiple different LOIs. And we've had some questions about how to think about the LOIs in the context of the larger project. So we have a question, do we have to submit different requests for each ask, or if they are part of a larger request, could a portion of the larger request be approved separately from another portion? Basically, I think about this as, should they think about how to break up their project in a way that allows for funding components, or should they submit their project and if it needs to be broken up for a variety of reasons, do that on the back end? How should they think about that in the context of LOIs?
Thanks, Deputy Commissioner Ricci. The way that I would think about that is by asking whether the projects can stand alone or whether there are interdependencies. If the projects can truly stand alone, then it is probably worth submitting them separately. But if the various elements are fairly interdependent, where if one were not funded, it would be hard for the other to succeed, or it's truly just necessary for the projects to be funded together for them to function at all, then they should be submitted as a single project, as a single proposal through one letter of interest. There's a spectrum there. There's going to be ones where, could it stand alone? Yes, but you really wouldn't want as an organization to undertake that project if it weren't funded in conjunction with other pieces. And if that's the case, again, submit it as one letter of interest, as one proposal. I think there was an underlying question, though, of whether it could be possible for a portion of a project to be funded and not the whole project if it were funded at the implementation stage. And I do think that that's possible. I don't think that it's the most likely scenario, but I wouldn't rule it out. Deputy Commissioner, you're on mute.
Thank you. My bad. So thinking, I mean, kind of going along that line, what should someone do if they have a single project which will have interdependent implementation and planning components this year?
Yeah, so similarly, there may be a project where you have some planning pieces that you want to undertake this year, but those planning pieces really only make sense if they're combined with a project that is actually being implemented. The planning components could be funded as part of an overall implementation award if it's seen as a holistic project and that's the way that you're proposing it. And so just because we have these different grant pathways, a planning pathway, an implementation pathway, doesn't mean that you have to separate the planning and the implementation components. If those components are actually interdependent on one another, or really preferable to undertake together, then you would want to submit one proposal for the full scope of the planning and implementation. And it would likely, if it were funded, be funded at the implementation phase with the planning components included.
Right. We're also getting a lot of questions about multi-year projects. So one of the questions we received is that I see that you're only looking for projects that can be fully completed at the end of year one. If we have a multi-year project, should we wait to submit it until year two, or should we submit it now?
That's a great question. And I think that it's a little bit of a misunderstanding. So the reality is that because the federal award is only provided 1 year at a time, there is no guarantee of future year funding. And so it is ideal if a project can be fully completed within the first project period, or if there's some sort of standalone component to a phase project that would be worthwhile to complete within the first year. That's ideal. But transformation, truly transformative projects often don't have that kind of timeline. They have a longer timeline to them. And so you will be able and should submit multi-year projects now if you're ready to undertake them or begin that process. And you should communicate what will be possible to complete within this first project period, what will be possible to complete in future project periods. And you have to be aware that if the federal award doesn't come through, then there may not be funding available for the future years of this multi-year program, and you may, or multi-year project, and you may end up in a place where if that first year is funded, that the full project can't move forward if for some reason there's funding issues. Our hope is that a multi-year project will be able to be funded to completion, because it's not valuable to only fund the first part of it if the truly transformative aspect is what comes in year 3 or year 4. So you're not required to have it only last 1 year this year. We are interested during the letter of interest phase in what the first year costs and what will be accomplished in that first year. In the full proposal, there will be the opportunity to describe the multi-year, both the multi-year budget and the multi-year project as a whole. Is there anything that you want to add to that, Deputy Commissioner?
I mean, I think this feeds into the timeline that I kind of want to move to the next question, because what's really important to understand is that it is critical for us to obligate funds within a specific time frame on an annual basis, and then to have those funds fully spent by the grantees in a time frame. And you will hear us emphasize this over and over again. It is critical that we do that. because if we don't do that, that can reduce future award funds to Alaska as we move forward. So it's really important. And part of what we're trying to do with this process is to make sure that entities really are ready to use the funds available for the implementation projects, because we don't want to have to be in a situation where we only have 5 months left before the funds have to be spent and an entity is unable to do that. That puts everyone in a really tough position. So you're going to hear us emphasizing that over and over again because it's really important. So be thoughtful about the amount of funding that you are asking for your project, and really make sure that you can complete that and fully expend that within the funding time period. So let's talk a little bit about the funding time period. And I don't know if this is going to sit with you, Megan, or if this is with Betsy. So either one of you jump in. But I think there's some confusion about the grantee timelines. So we've heard the grantees have until October 2027 to expend the funds, but then you hear us talking a lot about October 2026. Can one of you walk us through the timeline again for year one?
Absolutely. And Megan, that one might be a better one for me. So for the timeline that we're in right now, we're in the first budget period. And you hear us throw around a number of terms like budget period and the federal financial fiscal year and the this year and that. So I think it's really helpful to think about it in terms of where are we in the calendar year. So between now and October 30th of 2026, that's our first budget period. And that's where CMS has said, here's the state's award for the first budget period. And we have between now and October 30th of this year to obligate our funds, to collectively say, this is how we're going to distribute these funds, this is where it's going, and the types of projects that they are going to support. That's between now and, again, October 30th of this year. Then for everybody to finish using those funds, right, for us to, the state, to draw those funds down from our federal partners and distribute them out to subrecipients or kind of get them where they need to go, we have another federal fiscal year. So that takes us to September 30th of 2027. So by September 30th of 2027, our federal partners are expecting that the state will have drawn down all of the funds, and then we will have distributed them out to where they need to be. If we don't draw down the whole entirety of those funds by September 30th of 2027, that's where a little bit down the road, our federal partners will look across all states and say, well, what was left over in everybody's, pot, for lack of a better term, and they will look at those funds, gather them together, and then redistribute them across states. So that's something that you don't really need to worry about too much, that kind of future piece. That's something that we are tracking and we will work with our federal partners on. But for all of our purposes here, when we think about what kind of timeline do we have to work with for this first award year, this first budget period, we need to make our decisions between now and October 30th of this year. And then we all have to finish drawing down those funds by September 30th of 2027.
Thanks, Betsy. That's critical. I want to stick on timeline for a little bit because we did get a lot of questions about that. So just along those lines, we have a question regarding the timeline the Department of Health provided, and a question about how closely do our projects have to align with that, which we explained, right? They need to be aligned. But one of the questions we have is, if we aren't ready until FY28 for something on the timeline for FY27, will we still be able to apply later, right? So this gets back to, is this really our one chance to apply, or will there be other opportunities over the next few years? Anyone want to share the good news?
The good news is that yes, there will be many chances to apply for this funding. This is really the letter of interest period for this first year of funding. It is not for future years. So if you have a project that won't begin spending until after this first project period comes to a close on September 30th of 2027, then it should wait until at least the next round. The plan at this point is to be offering 2 rounds every year, this year, we can only do this project year, we can only do one because of the rapid timeline and the fact that the federal award didn't come until 3 months in to the award period. But in future project years, there will be 2 opportunities to apply. And for each of those, you will submit letters of interest for that round of funding. If your project is already funded and it's a multi-year project, it's likely that there will be a different pathway there than submitting a letter of interest as though it's a fully new project. But if you have a project that has not been funded yet or is new for that project period, you would submit a new letter of interest about that project at that time.
Thank you, Megan. Now, I want to stay on timelines for a second, but I want to move a little bit to something a little bit more concrete and closer, which is the timelines that we're thinking about for the letters of interest and the evaluation and the project implementation timeline. So what is that timeline? What should people be expecting in the next, 14, 30, 45, 90 days?
So I can maybe start with this, and then Betsy, if you want to add on to this, I think that would be good. But, the state of Alaska, the Department of Health, is working really hard to move quickly and to engage potential applicants as soon and as early in the process as possible. And as a result, there's lots of information that we have not yet received from CMS. And so there are aspects of this timeline that aren't there yet, in part because we're still finding out the details ourselves. We're engaging you, asking you to submit your letter of interest, and we are also learning along the way. We know that the deadline for this letter of interest is March 11th. And as soon as those are submitted, we're going to be working to make decisions about the readiness and planning grants, and then which projects will move to provide full proposals for implementation. The expectation is that will happen in the early summer, but the specifics of that timeline are still in the works. And I think that it's fair to say that if information has not been publicly announced, it's likely still in the works, and we're still working to finalize it. And so we can come up with estimates, but we can't give exact information. And so with that, I'll pass it to Betsy if you want to add any clarity to that.
No, I think that's a kind of fair assessment of where we are on the timeline. I think everyone has their favorite metaphor that they can use to talk about how quickly this program has grown just from inception and then kind of throughout that. And I know building the plane as we're flying it is one that people use all the time, but I like to think of it as all of the components are growing and being built at the same time, right? So that's where our federal partners are kind of growing and building the program expectations on their side at the state level. We're doing that too concurrently. And then for all of our community partners, you all are looking at this as well and saying, oh, this is, these are the projects that I have had on my my list of things that I would love to do if there was a fund source for them. And now you're kind of growing that up too. And then we're all going to work together to refine and to stretch as we go. So I think, again, this is maybe a long-winded way of saying we're doing our very best to provide you with the information for the timelines as we have it, and it will shift a bit. But I think, from where we are now, it's letter of interest and registration, and then we'll be able to move through and in the near term provide responses back to people so you have an idea of what to expect. The other piece of this is we're still building out that kind of working relationship through our cooperative agreement with our federal partners. and understanding what that review timeline will look like. So the ground will shift a bit for the first year or so, and then I think we'll all have a better sense of how to expect to move through this process.
Thank you. One thing that I would add, just a follow up to one of the questions about timeline, was when will the evaluation criteria or rubric be released? And we will be posting kind of draft criteria or rubrics probably in the next day or so for public comment and review. And so that will be updated on our website, and we'll go through our typical state notification system. So keep an eye out for that. Okay, I wanted to move to a couple of other buckets of questions we have specifically related around kind of fund uses. And I want to start by talking very quickly about renovations. And then I want to talk about the 5-year commitment, because we saw that come up a little bit. So question number 1, can funds be used for design for a new space or only for renovated spaces?
So I would say our understanding, and you'll probably hear me say this a lot, our current understanding is this, and that's because, we're going off of the information that we have at this time. Our current understanding is that you could do some design work. You could, say, here are some of the costs that we have. We need a purpose-built space. We recognize that the rural health dollars can't be used to fund that purpose-built space, but that there may be some design costs or preparation work or planning work that would go into kind of the front side of that. So I would say if that's a need that you have and it's tied to our rural health transformation program initiatives and goals, absolutely put that forward. And our current understanding is that that should be allowable.
So keeping on that theme, is there a cap? We've heard there's a cap of 20% of the state total for each award year. Is that true?
There is a cap on capital, capital infrastructure projects. So capital projects and infrastructure. And so that's thinking about, modifications to an existing building footprint, infrastructure remodels, renovations, that type of work, that kind of capital expenditure and infrastructure stage. If you need to replace existing equipment, those types of expenditures are specifically capped across the entire program. I think that's helpful to think about too, that when we look at the state's entire award of that $272.2 million for the first year, 20% of that overall award across the entire program, so that's $54.4 million for our first year award, can be spent on those capital expenditures and infrastructure type projects. And so we think of that in kind of the renovation upgrade space. We have gotten questions from people around equipment purchases and how are they treated under the Rural Health Transformation Program. And I think, if it's helpful to think about what do you need the equipment for, what purpose is it serving, and how does it tie into the goals. That helps us work with CMS to ensure that it's classified correctly. I think our current understanding is that if you have existing equipment that needs to be updated, needs to be replaced, that would fit into, in order for you to serve a new population or to do the program that you're proposing, that type of expenditure would go into that capital expenditure and infrastructure line. If you need some new equipment, to do, a new program or do something a little bit different, that may be that may be classified differently. So I think it's really helpful for us when you're explaining what type of equipment you need. Tell us how it's going to advance the goals, how it's going to be used, and that helps us kind of classify it correctly.
So, quick question. Is there any caps, any dollar amount caps for grantees for any project, including renovation projects, from a grantee perspective?
No, there isn't from a grantee perspective because this cap applies across the entire program. So if you're thinking about, I have a project and I know that I have some capital infrastructure needs, I wouldn't say any grantee is limited to you can only say 20% of your budget goes towards capital or infrastructure investments. I say that with a little bit of hesitation though, because you do need to be thoughtful about the overall cap. Like if your infrastructure needs at your facility or your organization are going to exceed $54.4 million, then you may think about how could you break that need or that project up into smaller pieces, because that's going to exceed the overall amount that we have across the board. Also helpful to think about if you're proposing a really large project that relies on kind of that renovation, that capital infrastructure space. I mean, put forward what you need so we can evaluate it, but do know that because we have that overall cap to work underneath collectively, that if you are proposing a project that includes that type of cost, we're going to have to be really thoughtful in how we distribute those dollars, because we know they're highly sought after. So just be aware of that. But I wouldn't say that, if you have a project and you say, wow, we really need 25% of our overall budget to go towards this, that may be allowable. It'll just, depend on the projects that are proposed.
Okay, I'm going to do two more to give you a break, and then we're going to jump into the 5-year commitment. Question 1, are funds able to be used for tech development? Yes. Again, though, has to relate back to the purpose of the proposal. Question 2, are feasibility studies allowed? Yes, that would probably fall under planning potentially, but we know feasibility studies are important. Okay, Betsy, 5-year commitment. We know from CMS that we can support certain workforce recruitment and retention incentives, right? But there's also a 5-year commitment required. Could you just briefly tell people kind of how to think about that?
Sure. And so the current information we have right now, and if this changes, we'll update it. But the current information we have is that if you are providing, financial support to an individual to go through a training program, go through a certification program, something like that, so they receive that kind of financial benefit that's funded with rural health dollars, and they receive a certification that is funded by the Rural Health Transformation Program money, then they would be, required to make that 5-year service commitment in a rural community. Both of those things have to be true. So if somebody went through a training program and it didn't result in a certification, say it was a, kind of like an upskill or an enhancement type of a program for a workforce, development or entity, then, and there isn't a specific certification that comes out of it, we don't believe that 5-year service commitment would apply. Or if someone went through a training program and there was another funding source that came in and covered the cost of the certification, I think then maybe that service commitment wouldn't apply. We're expecting to receive some more guidance from CMS specific to when and how that 5-year service commitment does apply. And we'll be sure to share that out as we have it. But I would say right now, the general rule of thumb we have is if somebody's receiving kind of like a monetary benefit and they also receive a certification package together, then that's really when that 5-year service commitment comes into play.
Okay, I want to shift for a minute and move to direct or indirect costs, because we've had some questions about this. 2 questions. Are indirect or admin costs allowed? And is there a way to capture indirect or administrative costs?
These are great questions. So because, you heard me talk about the caps that we have for our capital and infrastructure kind of categorized costs, there is also a 10% cap on administrative costs across the entire program. So that's both for the state to administer the program and to pull in the support that we need, but also for entities that have administrative costs. And really think about those administrative costs as being, what do you need to kind of do the grant management, to do reporting, to do, things that are really kind of in that line of administering the grant rather than administering the program that you have proposed that lines up with the allowable RHTP initiatives and expenses. So that's where we're asking all subrecipients or all community applicants to not propose an indirect rate. We are not accepting indirect kind of a percentage rate where you say this will cover kind of my other costs. We want you to propose all of your costs as direct costs. Tell us how much time, how much additional time is this going to take for your admin staff to do some of the grant reporting? Do you need an additional person to provide support to the program recipients? because if you give us all of your costs as direct costs, it's really easier for us to say these are the admin costs that this group has in order to administer their grant funding. And then these are the programmatic costs they have in order to administer their program and do the things that they have proposed. So we're not accepting an indirect kind of cost rate or percentage, but if you do have increased administrative expenses as a result of doing this, tell us about it. Tell us about it in a direct way so that we can be sure that we're really appropriately managing those administrative costs versus the programmatic costs.
And I just want to tag on that what Betsy is describing is a level of detail that will be necessary at the full proposal stage, but is not necessary at all right now. And so if that blew your mind a little bit and you're like, I have no idea how I'm going to figure that out by March 11th, the good news is you don't. We're just asking for you to share the broad range of budget for your full project at this stage. And I should say the first year of your full project at this stage. We are not asking for that level of detail.
So we've got about 8 minutes left. I think we might do a little bit of a lightning round. So I'm going to throw a question out. Megan or Betsy, one of you can catch it, pitch it back real fast, and we'll move to the next one. So first question, do projects need to be based in rural Alaska, or can they be based anywhere but benefit rural Alaska? Or is the whole state considered rural?
That's a great question. For the purposes of this application, I think that we have, I'm not giving a lightning answer, I'll be shorter. Projects can be based anywhere across the state. They do need to articulate how they serve rural communities. They do need to articulate how they support and advance the initiatives and kind of that rural health transformation plan that we've articulated out in the project narrative, and really is those kind of 6 initiative buckets that we've highlighted. But, projects that are located in Anchorage certainly can support rural residents, support rural communities, and can strengthen the healthcare system overall. So you do need to tie your project back to the overall goals of the program, but they can be located anywhere in the state.
Okay. Another question. Are tribal projects allowed, and what are the requirements?
Absolutely, tribal projects are allowed. Our understanding from CMS is that the requirements that the state is held to, and that all subrecipients are held to, that it's the same for everybody. So, I think that we would absolutely expect that we will fund many tribal projects through this.
Following initial letter of interest submission, can the Department of Health assist in revising to coordinate better with other projects to avoid overlap? I hear that as partnership. Can we help to connect partners?
Yes. Yes is the answer. I'm absolutely, we can help connect partners. And Megan, I don't know if you want to talk about any of the components in the letter of interest process where we're looking for partnerships. But I mean, really, again, if you're like, I have a partner and I want to tell you about it, that's really helpful. If you are looking for partners and you're saying, I really need some help, that's also helpful too. I think there are no wrong answers here. But Megan, is there anything they should be thinking about with that letter of interest process?
I would say submit your letter of interest at the place where you are. If you do not have partners yet, and that is part of the work that needs to be done before you implement, let us know. That is definitely something that we want to know. We don't want you to wait until the next round just because that's not in place yet.
Okay, lightning round. Can the final proposal change or differ from the letters of interest?
I mean, I think that you are, if you move from the letter of interest to the next stage of full proposal, it is because there was something in that seemed valuable and it looked ready to implement. If there are changes that, like new information you received along the way that is going to shift something, you're not going to be penalized for that. But it doesn't make sense to submit an entirely different project than the one that you described during your letter of interest.
Does the applying entity need to be an Alaskan held company or an Alaska-based company?
No. It needs to have some sort of connection to work in Alaska, and you will have the opportunity to share that connection. I know this is lightning, but I think it's worth saying as well. In choosing your lead entity, if you're a partnered project, the most important thing is the organization's administrative capacity to manage federal money. If the organization has that administrative capacity, the organization that's based outside of Alaska has that capacity, and the organization based inside of Alaska doesn't, the organization based outside should be the lead partner because they will be administering the funding.
What about confidentiality? Is the information submitted as part of the letters of interest? Will that be shared publicly?
Did you want to take this?
Sorry.
I mean, I can share that we're not going to be making public any of the information there. There is information about that you will share about like what your needs are, and if we're going to be, and what you're interested in receiving in terms of support. If we're going to be doing any of that kind of support matchmaking, we'll have to tell the organizations that would support you that you about your project. So there could be that sort of information sharing, but we're not going to be publicly posting LOIs or anything like that.
We will be sharing descriptive information, and just like any application that you would send to the state, if you do decide to include information that you view as confidential or proprietary, please mark that in the application. But again, it is possible that some of this information won't be public, so it's important to recognize that. Okay, I know we've got about 2 minutes left. Are there any business types that are not eligible for funds? So does it have to be nonprofits only, or can LLCs apply too?
LLCs can apply, but I do want to note that I've heard some nonprofits indicate that they think this funding isn't for them. It is. It's for everyone, every organization, whether you're an LLC or a nonprofit, you're all eligible.
Okay. Last question, because we have about a minute left. Can two nonprofits apply together?
Yes, you will need to determine who the lead entity is that would receive the award. The other nonprofit could be a subawardee of the primary award.
Okay. And final question, how can people access more information? I know we didn't get to everyone's questions today. I'm sure there's more. So where should they go? And what should they expect next?
I really recommend the Rural Health Transformation Program pages Applicant Information Center, which just launched. It has a wealth of information. It will be updated regularly. Otherwise, RHTP at alaskacf.org for LOI and process related questions, and then RHTP at alaska.gov for programmatic questions. If you're not sure, just CC us both. We'll figure it out.
Okay, and Megan, we're going to do this again next week?
There will be another office hours next week, yes.
Same time, same day. See you then.
See you then.
Thanks, everybody.
Thanks, everyone.